And I can remember when I was, I think it was in 4th grade. And I was drinking I think it was Slim Fast. I can remember my parents giving me a diet drink instead of dinner. My whole life I've struggled with weight out there. I've gained, and people talk about gaining and losing, but I've lost all my weight at least 4 times, maybe even 5, and gained it back. And every time you gain it back, you gain more back. So it's just always been an ongoing problem with me. And since scales only go to 350 out there, you're sort of guessing once you go over 350. I'd say the highest I got was 355, 365 out there. When I started deciding it was time to lose, either I was going to lose weight or I was going to be in a casket. The kind of health problems I had was type 2 diabetics. I had leg pains, foot pains, pains in my leg where you can barely walk. You can't, walking issues out there, sleep apnea, asthma, and I had one cholesterol problem, and I did get gout too when all of this was going on. I was out with this guy in his boat fishing, and I started looking around. I'd always looked around and see he was fatter than me whenever I was in a restaurant. It was always good news because there's always somebody fatter than me out there. But when I was out fishing with this one guy, I started looking around and I realized that there was nobody fatter in the boats out there than me anymore. And there were a lot of boats around, and we went out a lot of times, and I never saw anybody bigger than me. And that's when I really realized, I had a weight issue, and I was going to deal with it at that time. And that was the time I think I weighed 355, 365. I'd already made up my mind I was going to have the surgery. So when I went in to talk to Dr. Higa, he was, explaining the 3 surgeries to me. He was drawing his pictures where your stomach is going to be the size of pretty much a small banana is what it is. And he was explaining that, and I told him, well, that's fine, Dr. Higa, but I've already made up my mind. The surgery I want is the sleeve surgery. And so then he became really amiable. He was, a really happy guy. Let's just cut it out. But unfortunately, the problem I had at that time was I was ready to have the surgery, and I have to go through a series of tests, and I was ready to have it the next day out there. I'd already made up my mind. But meeting Dr. Higa was very good. He explained everything that you could expect to have a doctor explain to you. Surgery is pretty simple. They knock you out. In that part, you don't really know what's happening. They walk in, they put you to sleep, you wake up, and it's over with. The health care you got in the hospital was outstanding after that. I was in a private room, which I was glad for at that time. I had excellent health care from the nurses and the doctors that were there at that time. And the recovery I went through was, I guess, a normal recovery for surgery. Well, the one thing that really sort of amazed me when I was in the surgery at that time was there was really no pain out there. Anytime I had any kind of discomfort or anything, I was given pain medicine for it. And so the whole time I was in the hospital, there was no pain. Within the first week of being home, I was no longer on my CPAP machine because I didn't have breathing issues anymore. They were gone out there. By May, and I had my surgery basically the end of February, by 1st of May, my type 2 diabetic problems were gone out there. And I quit taking my medicine the 1st of July. And so you started seeing this rapid changes. My leg pains were gone almost immediately. When you weigh, say, 365, I say I was in the 36s. When I saw Dr. Higa, I was in the 32s, and now I'm down in the 22s. I can walk for 4 or 5 miles. I can jump up and down and do whatever I want. I can work on cars again. If I wanted to play golf again, and my back would let me, I could play golf again. I could do all this stuff again. I don't know how to tell the people that are in their 30s and 40s, have the surgery. Quit fighting this dieting and these problems you have. I've been dieting, like I said, since I was in 4th grade. That's over. The people that are in their 30s and 40s, you ought to have this surgery. It's going to change your life at a young age, and where you don't have to worry about your weight anymore.